This conference will now be recorded.
Everybody's hearing that? We're going to record the conference. So, all right. So, if Jeff would get on here, but anyway, I'm going to say, need you now. Just texting me back. Um, okay. So, in general, we'll start out, and I'm just going to talk about very quickly. We have
I'm getting that
made
echo. I can't hear it.
there. Can you hear us now? Everybody mute if they can. Okay. So, we made the official announcement that the conference has now been postponed to late April of 2021, but we will be having our virtual, if I can talk here, our virtual conference the Friday, August 7th and Saturday, August 8th. I sent it out to all the speakers yesterday, and we're going to only do 5 minutes of talk, 5 minutes of Q&A. And we'll cover them both Friday and Saturday from 11 to 4. The responses are amazing. All of our speakers are willing to do it, and they're also willing to be here in person in 2021, God willing. So we're getting great responses. So that's one of our big pluses right now. The hotel, they're working it out, but yeah, we shouldn't have any problem with the hotel, but he needed another week or so because the big conference that's in there is going to give up a certain amount of their space so we can have the room that we were promised for 2021. So that's all good news for the conference. So I think we're in good shape there. And while we're waiting, is caller number 2, could that be Jeff, you think?
Very possibly. I don't. This is Jeff.
It is Jeff. So this is perfect. All right. So you don't have a camera, or do you want to put your camera on?
I don't have a camera because I use I just dialed in.
Okay, cool, perfect, no big deal. We're in good shape. All right. So Carrie is on the call from the UK. Carrie, you want to? She'll go into echo, but what I'm thinking, why don't you sort of tell us a little bit of your feeling, your post, and then Carrie's from the UK, who works with a lot on the psychology side. Okay.
Sure. So you just want me to kind of explain along the lines of what I posted yesterday?
Yes, because I don't think
Okay.
you're the only one. I think many of our men feel the exact same way. But go ahead.
Yeah. From what I was hearing from the responses I got, it definitely sounds like I'm not the only one, and I'm thinking probably that a whole lot of cancer patients, not just male breast cancer, but just cancer patients in general, probably have a lot of the same feelings. So yeah, the main thing for me that I've been dealing with is the fear of having a recurrence. I was diagnosed last summer and had my mastectomy, and then followed by chemo. At the time of diagnosis, it was stage 1A, no lymph nodes affected. That's all good. One bad thing, the oncotype score was high, and so that prompted the chemo. But I was mentioning the fact that even before I was diagnosed with cancer, I've always been a bit of a hypochondriac. I've always been worried about, little symptoms here or there, or if I feel some sort of weird pain or discomfort in my abdomen somewhere, I always had the tendency to think the worst about what that might be until proven otherwise. And before my cancer diagnosis, I could always comfort myself with the thoughts of, hey, I'm a relatively young man. I'm only in my early 40s. I can look up the stats on this sort of thing. The odds of me having, you know, this particular type of cancer or whatever is 1 in, you know, tens of thousands or hundreds of thousands. It's so remote, you know, and I would say, Jeff, just stop worrying so much about it. It's way out there. I can't say that now. I mean, because, you know, I think that my, you know, my chances of having a recurrence sometime over the next, well, they said 9 years on the oncotype testing is about 1 in 8 or so after, you know, considering the chemo and everything. And so that's you know, that's a lot more realistic. And when I start having an actual symptom, you know, that I can't explain, then it really gets me worrying even more than I would worry before. I shared a story about how a couple months ago I started experiencing a little bit of it's kind of a crampy and at times a little bit of a burning sensation in my upper right abdomen, you know, in the neighborhood of where the liver is. So I eventually, you know, I got worried about whether I might have a metastasis there, and talked to my oncologist about it. She really did not think that it was anything, and eventually I requested the CT scan just to be sure, and got that back yesterday actually, and it was fine. So that's a relief, but you know, as I was saying, this isn't going to be the last time that I have an odd symptom, something I can't explain, or something that could potentially, you know, be a recurrence. And I've got to find some way to live with that, and deal with that, because this is just the first year of this experience for me. I've got years of this still to go, and you know, the possibility never really goes away. But it would be really sad if I allowed the constant fear of this to steal my life effectively, and to prevent me from living my life. You know, that would be almost like cancer is winning, even though there might not be any of it left in my body. So yeah, somehow I've got to find a good way to deal with that. I suspect it's not going to be easy for me, especially, but that's my issue, and I, like I said yesterday, I welcome any words of wisdom, and it sounds like I got some very good feedback yesterday on my post.
Okay. Hi, Jeff. Can you hear me?
I can. The sound isn't super clear, but I can hear you.
I'm going to blame the air miles. I think it's because I'm in the UK. Or maybe it's because it's late here and my internet's sleepy. I don't know. Firstly, I just want to say how fantastic I think it is that you've been so open and honest about how you're feeling, because I think quite often, even though we have supportive networks and setups like this, it's really quite difficult to be that candid. So I really praise you actually for doing that and sharing that experience, and putting it out there on the Facebook group, which Peggy actually only added me to this morning. Obviously, it's a private group, so I haven't had a chance to look through the support, but how fantastic to hear that people have been supporting. That's brilliant. I know you said that you mentioned about having maybe a bit of a history of sort of hypochondria, but actually I think that might be a bit hard on yourself. It may well be true, I don't know you as a person, but it's perhaps a little bit hard on yourself in this scenario. And the reason that I'll say that is because for everything that you sort of said that the brothers have been reassuring you, they're right to, because fear and anxiety in relation to recurrence of cancer is very normal. It's incredibly normal. It happens not just with breast cancer, but as you quite rightly said, with a number of different cancer scenarios. It's so normal, and I'm going to kind of give you a few kind of stats and figures because I know that men tend to like that. We're talking probably 30 to 50% of all patients actually that will have experienced some sort of fear or anxiety around recurrence, and that's irrespective of kind of what age or stage at which they kind of meet a cancer diagnosis. On top of that sort of 30 to 50%, within that you've then got roughly about up to 35% of patients who, from the sounds of it, would be similar to yourself, who become so overwhelmed by that feeling that it actually then starts to affect their quality of life. Would you say that that's kind of how it feels a bit for you?
I'm sorry, the sound is still pretty distorted. Can you repeat that question?
Yeah, so there's probably roughly up to sort of 35% of patients who experience this fear and anxiety, so much so that it becomes so overwhelming for them that it starts to affect their quality of life. Would you kind of say that it's having that effect on you at the moment?
I would say that at times it does. Yeah, there may be some patients where it affects them to a greater degree, but I think it does affect my life and, you know, things I'm able to enjoy to some extent.
Yeah. Okay. So as I said, you know, you're not alone in that feeling. That's pretty regular, unfortunately. You know, we don't want that to be the case, but to kind of give you some reassurance, you're not alone in that feeling. And actually, what research kind of demonstrates to us, because really, firstly, what I should mention is, rather than being a clinical psychologist working in a hospital in the UK, I'm an academic health psychologist. So I work within a university setting. So I teach health psychology, I teach a bit about men's health, and I also research in the field of men's health, particularly breast cancer in men. So what research kind of has shown us is that actually emotional distress is considered to be what they refer to as the sixth vital sign of a cancer patient's well-being. So that's on top of things like concern for your respiration, for your temperature, for your heart rate, your blood pressure, and pain that you might experience. Actually, emotional distress is that high up kind of on the list. So this fear, this worry about recurrence, it is normal. It's normal even when a doctor reassures you, as you have had recently in the last sort of week or so with recent test results. It's still normal to worry about that. And also what's quite common is sometimes when you have that reassurance from a clinician, that feeling then that somebody's told you that everything's okay, you can then feel as though the apron strings have been cut, so to speak. So I've now been released and I've been let out into the world, and now nobody's keeping an eye on me because there's nothing for them to worry about to keep a watch over me. And that can be quite distressing for some patients as well. So what you should find, and I don't know if this did come up with the information that the kind of brothers have left for you on Facebook, but generally what we would say is, you know, you're roughly about a year from when you were first diagnosed, is that right? Yeah. So you are.
Yes, that's about right.
I'm going to say only a year, because I'm sure it probably feels like the longest year of your life at the same time. But we have to, you know, acknowledge that time frame, and actually it isn't an awful long amount of time for somebody to kind of get their head around and to process something as major as a cancer diagnosis. But what you should find is that gradually over time, as time progresses, the fear and the worry about a recurrence of cancer usually starts to lessen. So whereas it would initially perhaps be at the forefront, so every ache, pain, twinge, headache, like you say, these feelings in your kind of abdomen and stuff, slowly over time they should become less front and center. Now that doesn't mean that they will completely go away, but it means that they won't be kind of center stage. So, and that really kind of goes hand in hand with the fact that, as you guys will well know from appointments with your consultations and your consultants, sorry, the risk becomes lower as you get further and further past those milestones. Okay, so it's accordingly with that. Two things really to kind of say: that the time frame of your cancer experience, your diagnosis, is it completely individual to you. No two diagnoses are the same, no treatment path is exactly the same, and no recovery time is exactly the same. Some people will like to use the term survivor, some people won't like to use that because they won't feel like they ever survive, they feel like they're permanently in a state of recovery. So it's really about recognizing and kind of being mindful about that. I think if you feel as though these kind of fearful feelings or these anxieties are progressing, or that they're going on for longer than you hope they might, you know, it's important to give yourself a bit of time, I think. But if you think that they're going on for a longer period of time than you would hope that they would, then there's a few things that I might suggest to you. So the first of those is to give yourself time. You know, don't kind of race to heal. This is a big thing in your life, perhaps one of the biggest things that you've ever had to deal with. So it's important that you take the time to process things from your perspective. And that might not be in line with how you expect that to happen. Okay, so it's important to recognize that you're going to have good days, you're going to have down days. Some days you might even forget that you ever kind of had cancer at all. It might feel like as if that feeling is far, far away at the moment. The other thing that I would suggest to you, if you're somebody which from what you've said, you've kind of had maybe feelings like this previously prior to having a cancer diagnosis, is to consider sort of formal therapy options. So speak to a professional, whether that be mindfulness. Okay, so mindfulness is about being in the present and about being engaged with what's going on around you in the kind of here and now, attending to that fear and recognizing that worry, which it sounds like you're doing, which is good. There's cognitive behavioral therapy, which some of you may or may not be familiar with. So cognitive behavioral therapy kind of works to improve emotional regulation. And that really is about challenging and changing sort of unhelpful thoughts and behaviors through a process of intervention and kind of problem solving. The other kind of alternative to CBT and mindfulness is something called acceptance and commitment therapy. So this takes a slightly different slant on kind of mindfulness. It's almost like a combination of the two. And this is about embracing the thoughts and the feelings that you're experiencing, and then committing to facing the problem actually quite head on, so that you're kind of facilitating change through the actions that you might then take, or the steps that you would take to kind of make yourself feel less fearful, less anxious. So there are the formalized therapy routes in that sense. If you feel that's really not for you, of course, as well, there's obviously going to be financial implications with that. You know, I know that it's a very different system in the US to what we have here in the UK. So we have to be mindful about that. If kind of the formalized treatments aren't really for you, there are a number of sort of self-help tips or tactics that I can sort of suggest for you. So the first thing to say, I know you use the term kind of hypochondriac. I don't see it like that. and the mind and the body are very much interconnected. If you are experiencing unexplained symptoms, something that is out of the ordinary for you, if that doesn't change within a 7-day period, it's recommended that you would visit a physician. So whether that is, from your point of view, putting your mind at rest or checking something out because you have a genuine concern, we would say normally in the UK, a difference that is unexplained, that hasn't changed, or certainly it might have worsened within 1 week, you get that checked out. So never ever feel that you are wasting somebody's time, that you have been there too many times, or you're this same person coming back, or oh, it's him again kind of thing. You have a right to check yourself and to report symptoms, new symptoms, okay? And if it comes back that they're nothing, fantastic, that's great. That's exactly what everybody wants to hear, you and the physicians, okay? If it's something slightly more sinister, then it's good, you've presented early and that you're on the case with that. So never worry about checking yourself and about presenting the symptoms. That's a very key thing, I think. What the concern is there is that you check yourself too often. So that can in itself become quite all-consuming. It's really important, if you're going to check your breast, that you follow the guidance and you check yourself once a month on the kind of roughly the same point in time, and that you follow the regular guidance for how to check and self-screen. So that's the first thing. The other thing kind of goes hand in hand with that, which is acknowledging it and not ignoring it, okay? Talking and keeping a journal is another way of dealing with things from a self-help or an anxiety management point of view. So a phrase that I like to use is offload and unpack. So when you talk to somebody, you are offloading to them. If you write something down, you are unpacking. So you're unpacking your mind, okay? I used to do this an awful lot myself when I was doing my PhD, because I would go to bed, so much was flying around my mind. It didn't feel enough to just write it down and then come back to it the next morning. So I used to keep a notebook beside my bed. And it's a practice that I would recommend to anybody. Sometimes just to get it down on paper, out of here and onto something tangible, can make the world of difference. If you're not somebody that feels particularly confident or comfortable speaking with somebody else, writing is also a really good exercise in that sense. If you're somebody that's quite private and holds on to their own thoughts, it's fantastic to see that so many men get involved with this group. But even though that you attend, sometimes it's harder to share those things. So talk wherever you can to anybody that will listen, family, friends, professionals, as well as kind of lay people. But writing down, I think, is really, really useful, and also it's something that you can refer back to. So if you had a similar feeling again 3 weeks later, 6 weeks later, you can kind of flick back and think, actually, I felt like that a little while ago. What was that kind of all about? And that sort of brings me on to my next point, which is identifying patterns or triggers. So usually, or not always usually, sometimes there can be patterns or certain things that set you off if you're feeling anxious. If you can recognize what they are, you can start to have a bit more of a handle and a bit of control over things. So is it that when you have not slept very well for a week, these feelings start to come in? Is it that your diet hasn't been very good, so these pains and these feelings that you're having internally, is it because we all do it, you've had a week where you've not eaten the best, you've not maybe had that self-care and looked after yourself in the best way? Has there started to been some sort of reasonable explanation for things that you can start to tap into mentally and see a kind of tangible change? So I think that can be really useful to people. So never underestimate the lack of sleep. That can be huge for people mentally, really, really important. Also, quite natural as well, if you've got consultations or appointments with clinicians, generally anxiety around that can be quite heightened, and then it can soften as you then kind of have that reassurance from a clinician and you've moved away from it again. So what can you do if that is the case, to manage that and to make you feel better? Is it something like going for a long walk before you have your appointment? Is it enjoying time with people, spending time with people that you care about? Something that will take your mind off it or put you in a relaxed state of mind before you then approach that appointment. Recognizing your locus of control is really important as well. I know that's a real psych term, I apologize, but locus of control is essentially recognizing realistically what is within your control and what is beyond it. Okay, so there are certain things in all of our domain that we can have a handle on. There are some things in life that we just absolutely cannot, and the breast cancer diagnosis kind of bam hits you and reminds you that there are certain things that are beyond your control. But we know that there are certain steps that we can take to help us when we've had such a diagnosis to live better, to live more healthily. So if, for instance, you have health anxiety and you're perhaps a smoker or something like that, you can take healthy steps to change lifestyle habits and things that might help you around that. So I think recognizing what can I control, what can't I control is really important. The last thing I want to sort of leave you on, because I realise I've been talking for quite a while now, one suggestion that I would have for any of you guys, the phrase living with cancer, I think we've all heard of that, right? Try reframing that. So instead of living with cancer, cancer lives with you. It's part of your life and you have then some ownership over it. So instead of feeling like you're going along for the ride with cancer, how about cancer being a part of your life? That means that it doesn't overwhelm everything. It's not all consuming. It means that, yes, okay, I recognize that I've got this condition. I recognize that it makes me feel this way sometimes, but that's just one part. It's one part of my day, one part of my week, one part of my life, okay? You're not defined by your cancer diagnosis. And it's really important that you recognize that, because I think that will help too in terms of fear and anxiety.
Jeff, has this all been helpful for you? I know that there were quite a few of the men, and thank you to all of them who came back and answered your questions. And that's exactly what this group does. They're there to support one another. So I did read through some of them. I did see, you know, Kevin Barnes is another very good one. He's gone through an awful lot and he's written some really great papers on this stuff. So I hope having, you know, Kerry speak with you has been helpful, but anytime, you know, if you're not getting what you need from the Brothers site, you can reach out to Peggy, you can reach out to me. We will get you whatever we can find, even if it's in the UK. See.
That's right. And we contacted Carrie last night, an early morning my time, and she was gracious enough to say yes, she'd get on, even though it's midnight there. But that's all right. we go to the ends of the earth for our people, our guys.
Absolutely. You know, I hope it's helped. I hope you found it useful. Kind of the information that I've provided you with, all of you, Jeff and everybody else. But you know, the main thing is talking with people in this environment, in the know. I can only come at it with a professional slant on things, but to speak with men who have experienced this firsthand is, in my opinion, one of the very best things that you can do. And the fact that you're doing that is already progress. It's already a great step.
I had thought about doing that around the time that I was finishing chemo. There was this question in my mind of whether I should ring the bell, you know, at the end of chemo. And ultimately, I was going to share my thoughts with the group even then. And they were similar, you know, and ultimately I decided not to, because to me, that sort of would have felt like I'm saying, yay, this is over. And I don't feel like this is over. I feel like, yeah, I feel like I've got a road in front of me.
Yeah, I think not only you, but all girls feel a lot of the same.
That's exactly what I meant by the term living with cancer. So you hear that phrase all of the time. Try reframing that and thinking about, hey, this thing came along and it came along and it put itself in my world. I didn't choose to be in its world. So think about reframing that and how that might be beneficial for you. How recognizing that it is a part, however big, however small, but it's a part, it's not everything. And that might help to, I hope, make it feel slightly less overwhelming for you.
So Jeff, this is Rick Davis. We don't know each other, but I am involved in supporting men in cancer, with cancer, and have been for many, many years. And we run other groups. There are a couple of things that occur to me. The first is, I think it would be really helpful if someone from MBCC could re-listen to the recording, listen to the recording again, and then maybe jot down the steps that Kerry has talked about.
Well, I'll share it to him, Rick. We'll share it out.
And I think that those steps could even go on your
For
website,
all the guys,
because they are so important for everybody. And what Kerry did was fabulous, fantastic.
Yeah,
it was a great presentation. And I think those points, it's very hard to absorb all of this. And I'm sure Jeff is thinking the same thing. Oh, you know, well, what was it Kerry said? She said,
you need to re-listen.
So I think that we can help you, Jeff, by getting them down. The second thing I want to say to you is that if you're not aware, we're working with MBCC to set up a group that will specifically allow you to air these concerns. We do that in a lot of our other groups, and we've got a group that Ron, who you can see is leading, and starting the end of July, there'll be the NBC Open Mic, which will allow you to talk to other guys who probably have experienced this. And the third thing is, if you open the chat window and put your email address in there, I will add you to another group that meets on the third Thursday of every month called Speaking Freely. And that's a group for men with any type of cancer to sit down and talk about all the issues that are beyond treatment.
Yeah, Rick, what I'll do is connect you all through email. I don't want to interrupt this right now, but we do have Joseph from Africa, Kenya. He's right there. Joseph, can you hear us?
Yes, I can hear you.
Yes, we got him. Yes, technology works.
Yeah.
So this is great. And I'm getting travel sick here. I was just in England and now I'm in Kenya. I don't know I can deal with this.
So not to interrupt, but while he's got connection, which is very poor in Kenya.
Yeah.
I want to introduce Joseph very quickly.
Yeah, it's also midnight here.
That's right. And that's Carrie.
We are already in Friday.
Yes. So it's already Friday. So just briefly, Joseph, while you've got a few minutes, tell everybody a little bit since you've found us and how it's helped you and possibly the other men in Kenya to help start coping. Can you hear us? Joseph? We might have already lost him. Joseph?
Yes, but the network is up and down. Well, I'm now almost 43 years. I got the lump when I was 28 years, several years back. And it was on my right side. And I'm a survivor. I thank God, but that I got through it. It wasn't bad, but it is now coming back. I was young, just after my university, and I sensed one of my breasts. The lump was coming, and it was unusual. I think like most of us men, nobody can expect a man to have cancer, breast cancer. Our culture here in Kenya, the cases are very few. It is also very scary. We don't admit it. So back then in 2004, I never expected it. In fact, even doctors took even more days to say this is a breast cancer. It took almost three months for them to conclude that, oh, this is a breast cancer.
Wow.
So up to now, even we are keeping it as a secret, a top secret in the family. We don't admit it, but I'm lucky it was just stage 1. Okay, it was going to stage 2, but we have also been thinking, how can I get that kind of a thing? This very rare here. So I've been continuing with our support services in one of the biggest hospitals in Kenya. I have seen some of our friends dying from other cancer, and it has been very, very painful to us. So cases are very few here in Kenya, and I lost a friend of mine with breast cancer almost a month ago. That is when I decided now I need to come out. I need to reach more men. We need to really go out and talk to people. But with COVID-19, most of us are restricted in our homes. We don't do a lot of travel. We can't visit. So I'm very happy I got this group, this coalition. And to me, I don't know if I'll be alive next year, 2 years, 3 years from now. But I'm very happy to be part of this family and to bring in some men. Here, men don't talk about it. They are scared. The culture does not allow, but I'm part of those people who really want to make a change to create awareness and reach more people. I think I can say that for now.
Yes, I agree with you, Joseph. And we're here. You're now family, as everyone knows. We never let you go. But if there are other men, I'm working on translation on a breast self-exam for one of the languages with Joseph. I'm getting that done. And it's just that it is the reality that you are your own best advocate, like all the other men on this call right now. And without you speaking up, just look how many other men in Kenya would not know. So we as your family appreciate you speaking up, because we are definitely global and we're here for you. And just like with Jeff and Brett and Ron, we're working on other ideas to get things going. And we, again, say, welcome to the family. We know COVID's bad when I have Joseph's t-shirts already boxed, ready to ship, took it to the post office, and they won't let us ship internationally. But I have it here when they'll let us ship it out, but they won't let us send anything from America to Kenya yet, okay? but we have it for you ready, and it'll be coming. And when you finally get it, I'll let you know, so you can be wearing your shirt on our calls to come. So we really appreciate you getting on.
Yeah, appreciate the friends who have been talking to me in my inbox. Several people, over 30 friends. I've never seen those kind of people really trying to talk about it. To me, it was a miracle having all these friends. Thank you.
Thank you. That's what the MBCC family is all about, is being able to let you talk. The MBC Brothers private page is so you can share whatever you need to share, and nobody's going to judge you guys, because we've all all of our families have been part of this, regardless of being the cancer patient or me being a mother of my son Brett, you know, and wives and partners. We're all here for each other. And we are the only ones that can make the change. But look at, you can't, if you're not on the video, look at Miss Pat Washburn's beautiful new twins, boy and girl.
I was
How
about to ask.
beautiful.
Yes, I can see all of you.
Oh, can you see it? Good.
Yeah, sure. Thank you so much. Thank you.
Yes. So we appreciate it all. And we'll keep things
Yeah.
going. But Mr. Ron, while you're here and while we still got Joseph, Ron Rapport's been working strongly in our brother-to-brother lifeline. All we want you to do is give us a progress report and how it's coming along.
Okay, so on the brother-to-brother update, we have several team members. We have Dave Talbot from the United Kingdom, John Falk, Michael Singer, Gary Wong, Alan Wilson, myself, John Warner, David Engel, Leonard Robertson, Rod Ritchie, and Brett Miller. Now that we have a bunch of, just about everybody has agreed to talk with whoever needs assistance. We need to find more people who need assistance. I've been pretty busy setting all this up, and I kind of dropped the ball when Jeff had his post. I guess that was my opportunity to get a hold of him faster. So I'll have to keep a better track of the posts. You know,
it's all right. We'll keep you advised as they come through. This week alone, on the backside where it's Messenger for Facebook on the coalition page, we within the last week have 3 new guys that are wanting to start sharing, talking to you all. I tell them I got to become friends with them on Facebook to bring them into the private group. And when I bring them into the private group, okay, you'll get notification, welcome to this new brother. That again will be your key to get a hold of them. And I will also email you, Ron.
Okay, great. Yeah, that's great. I'm also thinking of maybe in our specific areas, we could email our oncology clinics and doctors and maybe just tell them about MBCC and what we do. So that's an idea.
Great idea.
Another thing, another issue is the open mic virtual room. Rick alluded, I'm working with Rick. He alluded to it. Our first meeting is going to be July 22nd. So we're going to meet every 4th Wednesday of the month in the same room we're in now. I think it's, am I pronouncing it right? The Barniscus room? Yeah. Okay. It's going to be at 8 o'clock Eastern time. The decorum of the meeting is going to be mature, respectful, positive, uplifting conversation. We're not going to have any politics or religion or any of that kind of talk. We'll probably meet for an hour, hour and a half. It's going to be for the guys only, just to raise the comfort level. Now, we may have a couple meetings here and there where we'll, have the girls in with us should they want to join, and we'll have a different conversation.
No, we've been praying for this, Ron. I'm glad you're taking the bull by the horn.
Ideally, Rick would like 10 to 12 people on a call. Now, if it becomes popular and we get 20, 30, 40 people, we'll expand it and we'll have 2 meetings a month.
Good.
Now, our moderator for the virtual room is going to be myself, and Gary Wong, John Falk, and Michael Singer have all agreed to be my co-moderators, and they can be moderators as well if I can't make it. And we're all going to do training through Rick on this coming Wednesday. And I believe we're going to also be training with 5 UK brothers. Is that right, Rick?
Yeah.
So we're going to have like 9 people in there. Now, our first topic that we're going to be discussing is why do male breast cancer survivors not talk about their disease? And I think the second topic is, this recurrence, which Jeff brought out. It's something that's always on our minds. Okay, that's everybody. So I think recurrence would probably be our second topic. So Peggy, you're probably going to get some publicity out there for this, eh?
Oh yeah, you just let me know what, we'll shoot it out to the guys and they'll
Okay.
know, and we'll post on the brothers page too, the secret group, so they know, who you need to get on
Right.
there and stuff. But yeah.
And I think I sent you today. I sent you some bios and pictures of the moderators.
Oh, perfect. Excellent.
Yeah.
We'll get that out
Um,
there.
Ron, do you need further topics, or how are you going to mine for that?
I actually have a whole bunch of topics that I Googled breast cancer support groups, and just to see what they were talking about. So I have a whole list. But yeah, if anybody wants to email me some topics, that'd be great. Everything's what we're going to do is we'll start on a topic, and then if we get through the topic halfway through the meeting, we'll just open it up, and we'll talk
So
about
Ron,
anything.
with that email I sent out with your information, did you get any responses from any of the brothers?
Yes.
Okay.
I have contacted one fella already,
Good.
but most of the responses were people who wanted to be on the team. So
Okay.
really, what we need now is people to help.
That's
So,
good.
yeah.
And then that's why I say we'll keep responding, so we at least know they're reading their emails besides reading the brothers page, and that works. That's a beautiful thing.
Yeah, and I did attend one of Rick's groups called I think it's called Men Talking Freely, where they have different kinds of cancers, and so I got a kind of a feel for
Excellent.
what we're going to have.
That's beautiful. So Joseph, we want you to join in too, from Kenya, from another country, because that helps the world change, and that's what we need. It can't just be the UK, the United States, or just Kenya. We need the whole world to change their mental attitude about men and breast cancer. That's the reality of it all. So, I mean, there's Miss Riley talking to Pat. Miss Riley's on the scene now too. But is there anything else anybody wants to talk about or bring up? Anybody have anything else? I mean, I think. Okay. Oh, yes. Go, Rick. I can't hear you.
I just wanted to say, in case everybody other than you and Ron and Kerry are wondering, the reason why we're having 5 UK gents join us is because thanks to Peggy and to Kerry, we plan to start a EU UK male breast cancer virtual support group at a time that is a lot more convenient to EU UK folks, and also I guess we're learning we could extend that group to
Joseph in Nairobi. Yeah, we should, because
I was just going to say, if the time difference is the same, then sure, yeah.
So
by all
Joseph,
means.
you can hear us. We're going to put you into the UK group if that works. No, he just went mute again. He's learning it, but I think that'll be a good thing.
And South Africa too. I know South Africa.
Yes, we've got a couple in South Africa too. So that's a great idea, a brilliant idea. Just on a final note, I think everybody here is signed up for Citizen. We're at about 26 men. We need 100 to start being considered for clinical trials for men. So the more men you can talk it up to get signed up, the better. We need to get there. The actual push that we did, the onboarding, it worked pretty good, but we don't want to get it to the guys that they're thinking it's spam. I'm still sending out that email daily to help remind you guys, go sign up if you haven't signed up. Because again, all it's going to do is help find more clinical trials to get started for you all, for all of our men, stage 4, any stages, and to get more medical research going. So the more of the men that we can put together, the better for everyone. So
What about people like in this group or other people just emailing your acquaintances and your friends and just talking it up and telling them about
yes,
Citizen, telling them, hey, this is what's going to drive research.
yeah, for male breast cancer.
Yeah.
And I mean, through all of this, the 10 years that we've been dealing with our family, I've never had a company care so much about helping to make a change for especially male breast cancer. And it's only because the founder and everything, he lost his sister to breast cancer. And it's her dying wish that he's doing to make sure all your medical records are in one place. So when you go to a doctor, you can quickly and easily send all your information to the doctor. And thank God for him. I mean, the man, does not need to be doing this. He sold his first company for over $10 million to Apple. So the man doesn't need to be doing, but like he says, I do it not only for the dying wish of my sister, but to help change what cancer is doing to the world. And he says, if I can do that by just getting medical papers together for a person and that helps make it a little bit simpler, that's what he's going to continue to do as his life mission and a promise to his sister. So
Peggy, is there a deadline on this at all?
no, there isn't. I mean, the sooner we get it, the faster we start getting into more trials, guys.
Okay.
So we got to have at least 100 in numbers for
Right.
these trials to consider doing it.
Do these have to be US guys, Peggy, or is it open to all?
No, it can be any. It can't. The app itself only really works in the US, but anywhere you're at, you can go upload your information straight into the Citizens app. So that's the perfect thing. Anybody like Joseph can go put all of his records from Kenya, upload it into the Citizens app, and then all his medical records are going to be in one place that he can then send the link to any doctor he's seen in Kenya and doesn't have to go track and trace his medical records. Once
Peggy,
you get him,
Okay.
yes. Go ahead.
Peggy, I have a question. Have we communicated with any of the big research engines out there like the Fred Hutch or people that might be able to aggregate numbers more quickly than us individually?
Yeah, we're connected. We're connected to
Yeah.
all of them. We're also connected to the Dr. Susan Love Research
Oh
Council.
God, yeah, and she's gonna talk. She confirmed she's gonna be in our virtual deal. Just yesterday, I've been going back and forth. She's actually on vacation until the 5th of August, but she says I'm coming back, and on that Friday, she's doing her talk. So I feel fortunate that she has agreed to talk because I've met her at San Antonio many years, but she is an unbelievable, delightful person, and her research is amazing.
Just to give you a little update, I posted it. It should have come out today, but Michael Singer and Michael Kovarik were actually asked to sit on a panel recently.
Yes.
It was like 2 days ago with Susan,
Right.
her foundation, and it was about diversity and
Right.
the need for change with research. And what Michael found when he was doing some of his studies is that one of our men, Oliver Bogler, who is himself
A doctor.
and has breast cancer, and his wife also,
Our breast cancer.
but he sends out, and those I tweet or Facebook as well, clinical studies that do include men. Right now, currently, there are 24 clinical studies that include men. But if you trace back to see when they've gotten to a stage 4, or like they've completed, that a trial has actually gone through and concluded and can go further to being onto research, there's only 2.
Yeah.
So that proves right there that when Citizen is asking you to put your information in there, they're not doing it, you know, just so you can carry your information around. Honestly, the back end of Citizen pulls out all the analytical data that is in there and uses it for research. So
Yeah,
that's why it's important to upload your information into these apps. And I was on a call yesterday with a company, Kerry, actually in the UK, that is doing something very similar. You might want to look it up. It's O-Wise, the letter O and Y. And they are
Did you
very,
share that on? Did you share that on Twitter? I saw that on.
Yeah.
they're
Yeah.
very interested in their
Working
product
with
is going to be here to the United States, and they actually are glad we connected. They might have some of our guys beta test for them. They're looking to do it for the fall. But I did tell them about Citizen and also MBC Connect, because each one of these applications is almost running side by side.
Yes. And bringing them all together too, so they can all hopefully get their researches faster by working together. This and again, when this comes to us, we vent to make sure it's real. Sherry and I do. Okay, Sherry vents very well. And once we realize it's real, we share it to you guys. If you choose to do anything with it or go forward with it, that's your choice. But when they connect with us, we don't want to leave anything unturned for you all not to know about it. We want you to know about what's been offered. And that's what's helping to going to make change. I mean, all I can say in the 10 years time, yes, it's been baby steps, but guess what? Just when the coalition went up on the internet in 2014, oh my God, look at the changes we've all made. And we can't do it without each other.
Progress is progress, baby steps or otherwise.
Totally.
Doesn't matter how long it takes you to get there. It's fantastic.
But look where we're at today to be able to even be talking to each other. That's amazing. And having Joseph from Nairobi on in Kenya area. I mean, that in itself is just amazing to have all these men from all over the world to realize they are not alone. And no, we can't make change overnight. Together, we will change the world. And everybody knows that. So,
exactly.
Yeah. So if there's any other questions.
My question.
Go ahead, Joe.
My question about Citizen. This is a quick one about Citizen.
Sure.
Once we share our information, is that secure? Is our information
Yes, it is totally secure, and it will never be shared without you saying you want it to be shared. They cannot share it, okay? And they would, if they had an opportunity in, say, Kenya for treatment for what you've been going through, they would email you first and say, hey, Joseph, we'd like to connect you with such and such. Are you interested? If you say yes, then they would connect you via email to a researcher in your area. So everything in the United States, it is all under the HIPAA laws, and it's all, you know, all protected by HIPAA in the United States. I don't know what your laws are in Kenya, but again, they won't share anything. And the call, I'll find the link from the call when Citizen was talking, and I'm going to share it to you, Joseph, so you can go watch it. And it tells you all about Citizen.
Yeah, sure.
You there?
The reason.
Yeah, can you hear me, Joseph?
I don't like talking. Yes, I can hear you.
Okay, could you hear us? Okay, so I will share you the link from the last month's call that was all about Citizen, so it'll help you to understand how it all works.
Okay, thank you.
Okay, that sounds good. Well, if there's nothing else, without further ado, happy 4th of July for everybody in America, because we won't be back on until the end of July. And we're looking forward to our virtual conference. Yeah.
Peggy, you know how the Brits celebrate 4th of July, don't you?
How?
Thanksgiving. Thanksgiving.
Oh, seriously? Okay.
Yeah, that's when we got rid of you.
I love it. I love it. That's perfect.
Okay. Goodbye.
We
Goodbye.
can't enough applaud Mr. Rick for allowing us to have this meeting. We
Thank
love you
you,
guys. Okay.
Okay.
Great to speak with you.
Goodbye on that note.
Bye-bye.